What is psychosis? Psychosis is a combination of symptoms resulting in an impaired relationship with reality. It can be a symptom of serious mental health disorders. People who are experiencing psychosis may have either hallucinations or delusions. Hallucinations are sensory experiences that occur within the absence of an actual stimulus. For example, a person having an auditory hallucination may hear their mother yelling at them when their mother isn't around. Or someone having a visual hallucination may see something, like a person in front of them, who isn't actually there. The person experiencing psychosis may also have thoughts that are contrary to actual evidence. These thoughts are known as delusions. Some people with psychosis may also experience loss of motivation and social withdrawal. A person who is experiencing psychosis may often have confusing and disrupted thoughts. Some examples of this include constant talking with rapid speech patterns, switching topics mid-sentence with no explanation, a sudden loss of their train of thought, causing them to pause or freeze abruptly. What are delusions and hallucinations? Delusions and hallucinations are two very different symptoms and causes of psychosis. Each case of psychosis is different, and the exact cause isn't always clear. There are certain illnesses that cause psychosis. There are also triggers like drug use, lack of sleep, and other environmental factors. In addition, certain situations can lead to specific types of psychosis developing. In general, some of the factors involved in psychosis are genetics, trauma, such as death, sexual assault, or living through a war, substance use, drugs like LSD and amphetamines have been linked trusted source to instances of psychosis in some people. Mental health conditions, like schizophrenia, risk factors for developing psychosis. It's not currently possible to precisely identify who is likely to develop. However, research has shown that genetics may play a role. People are more likely to develop a psychotic disorder if they have a close family member, such as a parent or sibling, who has a psychotic disorder. Types of psychosis. Some kinds of psychosis are brought on by specific conditions or circumstances. Brief psychotic disorder. Brief psychotic disorder, trusted source, sometimes called brief reactive psychosis, can occur during periods of extreme personal stress like the death of a family member. Someone experiencing brief reactive psychosis will generally recover in a few days to a few weeks, depending on the source of the stress. Drug or alcohol-related psychosis. Psychosis can sometimes be triggered by the use of alcohol or drugs, including stimulants such as trusted source methamphetamine. Hallucinogenic drugs like LSD often cause users to see things that aren't really there, but this effect is temporary. Organic psychosis. A head injury, illness, or infection that affects the brain can cause trusted source symptoms of psychosis. Psychotic disorders. Psychotic disorders can be triggered by stress, drug or alcohol use, injury, or illness. They can also appear on their own. The following types of disorders may have symptoms of psychosis. Bipolar disorder. When someone is living with bipolar disorder, they experience extreme mood changes. When their mood is high and positive, they may have symptoms of psychosis. They may feel extremely happy or grandiose. When their mood is more depressed, the person may have symptoms of psychosis that make them feel angry, sad, or frightened. Delusional disorder. A person experiencing delusional disorder strongly believes in things that aren't real, even when presented with opposing evidence. Psychotic depression. This is major depression with symptoms of psychosis. Schizophrenia. Symptoms of psychosis generally appear in schizophrenia. How is psychosis diagnosed? Psychosis is diagnosed through a psychiatric evaluation. That means a doctor will watch the person's behavior and ask questions about their experience. Psychosis doesn't have many medical complications. However, if left untreated, it can be challenging for people experiencing psychosis to maintain quality of life. This could cause other conditions to go untreated. Most people who experience psychosis, even severe cases,